all of our panelists, and now it's question and answer time. We'd love to have a few questions for our panelists. Does anyone have any questions? Anything? Okay, I'll ask one. I'm just curious of the professors, and you certainly mentioned it, that it's hard to be an entrepreneur. So what motivated you as professors? I mean, you don't hear about that a lot. I mean, how can we maybe stimulate more of that to get more people out of the university, commercializing, getting out there, and being entrepreneurs?
Lord.
Yeah.
That's not a question I had anticipated. This is actually not the first time I've been involved in something entrepreneurial, but the last time my involvement was simply, I was a chemist. Now, unfortunately, I'm an owner, which is different. But one of the things that I learned early on is that it is important when you make a discovery to protect the intellectual property, particularly in a field like I am, which is basically medicinal chemistry. If you do not protect the intellectual property, you will not have any effect on humanity, because it currently costs between $800 million and $1 billion to get a medical compound, a drug, from the laboratory to the marketplace. Somebody is going to have to do that. Now, if they don't have patent protection, then the minute they have finished the testing that gets the compound approved for use, anybody can jump in and basically use all that science for free. Given that and the realities of business, nobody's going to spend $800 million in order to give their competition a free leg up. And so the first thing that I had to do in my development, at least, was to understand that there is not a fight between protecting intellectual property and being an academic. That people who look down on, oh, well, you patented it, you didn't publish it in the literature. Well, yeah, I patented it, and now I'm going to publish it in the literature. It's going to get out there, but with that patent protection, if I've got something that's really going to help people, there's a chance that it actually will help people down the road. I think that's perhaps the hardest lesson to learn. And once you understand that, then either finding somebody who'll be entrepreneurial for you, which is the way I'd have preferred it, but it's not the way it worked out this time. But that's at least going to get your ideas out there and actually used. Without the IP, it doesn't happen, and that was the hardest lesson to learn.
Anything, Jim, Mike, Ken, anybody else with the press? Just curious.
Like I said, my technology is a little bit in earlier stages, so I'm not really to that point of taking on any type of entrepreneurial activity. When I was a grad student, one of the things I worked on as a grad student got spun into a small company, so I've kind of seen that process before, and as scientists trying to be business people, it's difficult. I definitely know there's a tremendous amount of work, and you're not really in your element, so it takes a lot to keep something like that going. I know that much.
Yeah, sure enough.
Well, yeah, for me, I think one of the things that I've noticed, there was even a discussion this week with one of my colleagues who was saying one of our guys is filing a patent, and there's no way he's going to count that toward tenure because it's not like a publication. No way, this guy was saying. I said, you got to be kidding me. And so there's this culture, and that has to change. It has to change from the administrative level, what people can say that it's okay, and academics is kind of political anyway. So that has to change. But I think just having awareness that it's possible to do this is really key, and just educating faculty at campuses that it's possible. And I think that Wysis and MJON have done a great job of this. I mean, I realized after a while that, when I was like 6 years old, I was selling American seeds, flower seeds and stuff. And then I carried a suitcase around for Weebles or Boy Scouts, and I sold that stuff. And then I had a painting company, and I realized I'd been doing this all the time, but it never occurred to me that I could start a company. I just went into science. And so now I have a couple of companies, and it's just interesting, but no one told me that it was okay or that it was possible or that's what I was doing. I suppose I should have realized, but I didn't until last year.
Great, thanks. Yeah, go ahead, Carl.
I have a question for Randy and actually for everybody up there. All of you involved in these entrepreneurial activities. It's really a labor of love. I mean, this is above and beyond what you're getting paid for in your ordinary lives. With Randy's situation in Aurora, we know how taxed the docs are to bill and to get their job done. How receptive are they to this sort of thing, and how receptive are their bosses to letting them do this sort of thing?
Yeah, that's a great question. I want to clarify that to say I spent 28 years in the University of Wisconsin system before I went to Aurora 3 years ago. So, and I have several patents and provisional patents, so I know that game. But just to go back to the last question a little bit, you could go upstream because a lot of times people don't even realize they might have something that is entrepreneurial or should be protected. So, and then they don't, if they haven't been down that road, they don't know the process, like David said. So, one is recognizing that you might have something there. I often find that physicians, whether they're cardiologists or oncologists or whatever, often discover things along the way that they don't think about taking to the next step. So we do everything from phase 2 to phase 4 studies. We have animal care laboratories. I mean, we're pretty much set up as a playground at Aurora that all the resources are there. It's just getting the ideas out. We do have to find ways. I mean, physicians are on productivity models. They're expected to generate revenue. So when you pull them off into an area to explore research or to take an idea and run with it, we have to give them a lot of support. And Dr. Millikan will know that in some cases, we buy their RVUs, their units of clinical practice out so they can spend time doing this. So I don't know if it's really welcomed until they start to see something that's an outcome. The nice thing about Aurora that was different than the academic setting is it's not, publications and grants are nice, but it's really, it's outcomes, patient-centered outcomes. If you can have an outcome that makes a difference in the quality of care or in the lower costs or lowering costs or something that helps the quality of life, Aurora really, that's in alignment with Aurora's values. But I would agree with you, Carl. I mean, everybody who's sitting up here does it because they're passionate about their science, is passionate about what they do, and sometimes that gets in the way of thinking you got something unique, right?
We have a question back here.
Yeah, maybe on the other side of the spectrum, do you find undergraduate students engage differently if they're working for a startup company as opposed to maybe just working for the next publication? Are any
Short
interested
answer is
in
no.
becoming involved in the business side of
The
things
short
as
answer
they're
is
doing
no.
the science?
But my students, at least, are doing the science.
Yeah.
I don't have any business students involved. So the short answer is no.
And I would say also, I think I had 15 undergraduates employed this summer, or something ridiculous it was. And I think the answer is also, to a certain extent, no, but on the other hand, what we've done is we pay them to do the research, and that's a different model than is often around. Again, get them out of Walmart and KFC. And so they are really interested and they're able to do it. So what we do is we're able to take advantage of talent that is often relegated to flipping burgers. But in science, they're sort of in science because they don't know that they're going to make more money if they're in something else.
Any other questions? Yeah, Nick?
Marshfield folks. Okay, so you have this huge repository of 50,000 or more DNA samples. So talk about some of the privacy issues, ethical issues, and what you can do with this, not do with this, as you are identifying what you can do with warfarin or genetic resistance to different drugs and so on.
I can briefly talk about it from the Aurora side because we spent about 4 years on the consent process, getting the NIH certification, and so the patients are consented at the time of registration. And so it makes it very easy for, and it's, I'll preface it with right now, all of this is de-identified. We can't go back to the patient. If we find something, if we do a genetic analysis and we find a variant, we can't go back to the patient. This is all for research. At some point, we're of course going to want to go back to the patient, but there's so much research that needs to be done first that that we didn't want that to lower the consent rate. So patients are consented to donate their blood, the residual blood, for research purposes, and we have we have a system in place that protects their identity from it. So that allows us then to use that DNA for almost anything. And Aurora is a healthcare provider. We don't have we have a lot of scientists, but we don't have, our interest is to collaborate with industry and academic institutions around that. So it's a bit of a resource, and we welcome the invitation. But consent process was really important to get right. And the other thing about, I think, the biorepository is it's totally automated and computerized. So we can put samples in, we can retrieve those samples, and we can link them to the clinical information. That's all done computerized. So what used to take months or weeks is, we can do in a pretty short time period.
Hello, I have a question for the cool science and as well as the professor who do the photocatalyst research. My question is, you do the collaboration with the private industry, and how this patent and IP stuff works, and also you're getting the funding from the, from the WISEs. So my question is how, when you become a product commercialized, and how this profit distribution, and then the, intellectual property, how this,
That might
the rights, all that.
John may have a better idea.
So for each of these projects, we have a agreement in place, a research and development agreement in place. The inventorship of those inventions, whether it is a fuel cell or anything else, is determined, of course, by US patent laws. So it could be a UW faculty member, a student, or it could be from the industry. So that is determined by the patent laws. But in terms of once the technology is developed, we have an agreement in place that will allow the industry, for example, in this case, Cool Science, to take an exclusive license for that if they decide to do so. So there will be an agreement, a license given to Cool Science that will provide a royalty back to the UW system, and that royalty is then shared with the faculty member, the student involved, or anyone else involved from the UW side. Of course, Cool Science will have their own share of the profit from the private industry side. Does that answer?
And I might add too that that relationship is such a good one. With VibTech, we had some of our own intellectual property, but then we went and developed some products jointly with UW Stout, and so there are two jointly owned patents or patent applications that we have in place. And if VibTech were to try and defend our own patents, we don't have the resources to do so. And that's a great thing that WISES brings to the table, is they do have that financial backing to make it so that you can actually defend your patents. And knowing that a patent is only as good as your ability to defend it, it becomes a very important thing for a startup company to have somebody like WISES on your side.
Great, I think we have to wrap it up here because we're a little late. I feel like we should have a roast though, right? It's like a big love fest with John right now. But, and I should be able to pull out an award now, like the Cecil D. Mill, whatever, but for science or entrepreneurship. So anyway, but thank you to all the panelists. I really appreciate it. Outstanding work, really outstanding work. Great. So with that, Carl would like to wrap this up.
We also want to thank Lisa, and we love her enthusiasm. I know Lisa because she's a scratch golfer, and Wharf used to have these golf tournaments, and we'd always want Lisa on our team because she was the ringer. But at any rate, all of you are going to be getting some survey information about this, and we'd like you to respond to it. Hopefully it will help to make our programs continue to be good programs, but improve them as we go forward. And we want you to keep posted for new bootstrapping programs that we have planned for this coming season. We have treats out there. The panelists can stick around and you can talk to them. I want to thank the panelists. I think it's great. These programs, of course, that the panelists are talking about with the collaborations with UW System and with the small business, they've been funded through both grants from the state as well as funds that WISIS has leveraged. But it's important for us to encourage the state of Wisconsin to continue to provide programs like this. It would be nice if we had more of them, but we know that we're in tough economic times. But all of us do believe that stimulating small business development is going to help get us out of these problems. So thanks very much, and join us for some treats outside.